Every year on the 15th of February, International Childhood Cancer Day serves as a vital reminder that cancer knows no age limits. This global campaign raises awareness about the challenges children and teenagers with cancer face and the support they need to improve their quality of life. While they follow similar treatment protocols to adults, young patients rely heavily on parents and caregivers to ensure they adhere to their treatment plans. Cancer Association of South Africa health specialist consultant Professor Michael Herbst joins us now for more on this conversation. Professor, thank you so much for your time this evening here on SABC News. Now, today truly marks as a stark reminder, of how brutal cancer really is, particularly when it attacks children. Tell us more about this day as we observe it.
Absolutely, Mbali. You're really hitting the nail on the head. You know, children, apart from just which we emphasize, that they are dependent on others because they can't make their own arrangements to go to a doctor. So they need their parents to notice even that there are changes in their health so that a first appointment can be made for them. Then when it gets to treatment, they are dependent on parents again or a caregiver to accompany them, to make arrangements for them for transport, to be able to go and visit the doctor or to visit the treating center where they receive their radiation therapy, their chemotherapy, or whatever treatment they are getting. And this is not always very easy because we know that financial difficulties in families very often is a cause that children cannot keep their appointments when they have to go for follow-up treatment. And this really creates so many problems because if a child or any person does not attend every one of their appointments and there's a break in treatment, they can build up resistance against the medicines, and this creates major problems for the future.
Then what would you say is needed to support children? Because you are saying that they are heavily reliant on, their caregivers, their parents, and the adults surrounding them. What support is needed for children and teenagers who are undergoing cancer treatment?
You know, I think one of the very first important things is that parents will be well informed, or the caregiver, those responsible for the care of the children, will know how serious the condition is, know what type of cancer the child has, must be aware of the importance of continually attending every appointment, not to have a break in the treatment of the child, because without that, the children are really not able to do that for themselves.
And when it comes to cancer treatment, it can really take a toll on children, but at the same time, it really does affect the family, right? And just the overall living conditions. What support can be given to the caregivers and the parents during this very crucial and important time when children undergo treatment?
And Bali, the very important thing to remember is that the Cancer Association is there. We have a toll-free telephone number, 0800 22 6622, and parents and caregivers can phone the organization and make an appointment. And we do have what we call TLC facilities. Now, most people, when they talk about TLC, they think of tender loving care. Yes, that is so. But when at cancer we talk about TLC, we talk about tough living with cancer, especially for children. And we do have facilities at most of the major treating centers where children can even be admitted into an accommodation. And then they can have their treatment, and at the end or over the weekend, at the end of their treatment, they can go back home again. But the facilities are there, and people only need to make contact with cancer. They can also, those that have access to the internet, can visit the cancer website for additional information, www.cancer.org.za, and there they will find a lot of information about the type of cancer that their child may have, as well as the importance of maintaining their whole treatment schedule. It is so important because children really do need their care. We need them to go into remission and to become adults again so that they can continue to provide for their own children again.
And maybe, Professor, if you can, just paint a picture for us and just tell us how bad are, the rates of cancer amongst children in our country. Would you say it's on an increase, or do you think that it's slowly beginning to be dealt with?
Bali, really, this is the sad side of cancer. Years ago, we would say that, 1 in 10 people will have known of somebody in their family or in their circle diagnosed with cancer. We now have brought that figure down to 1 in 2, and at most 1 in 4 individuals know of somebody who's been diagnosed with cancer. And this is all the way in all age groups, but especially so in children. We do not really know the true figure of children because we know that there are many children who have cancer that haven't been seen by a doctor, who haven't been diagnosed, and they may die, and the parents don't even know maybe while their child died, and they may only find out after the child has passed on, when there is a post-mortem or investigation following. Then they may only find out. And we also know that the primary healthcare clinics and health facilities in South Africa don't provide the services to nearly 80% of the population because of a problem with staffing, with a shortage of nurses, very often treatment equipment not working, treatment facilities not being adequate, and medicines not always being available. And all these things impact on the health of our children.
And Professor, you really paint a painful picture when it comes to dealing with cancer, amongst children and even teenagers, if you'd want to extend it to that. Maybe if you can just give us an insight as well. You speak a lot about treatment, and when one is a child has been diagnosed with cancer and, going through, government hospitals, and like you're saying that some parents really don't even know if their children have been diagnosed with cancer. Should, when it comes to some of the advice you can give to parents with some of the common symptoms that may be presented in children, and, what advice can you give parents and caregivers in terms of, some of the common symptoms when presented with children that they can immediately go and see a healthcare practitioner?
Thank you, Barney. That is so important. A very important question that you're asking. I always say to parents, anything that is different in your child today, different to what he or she was yesterday, last week, last month, or last year. This is something that needs to be reported, and an appointment should be made as soon as possible so that the reason for this change in the child can be determined, and it can be decided, is this something that needs further investigation or further treatment? We're thinking of things like a swelling that the child has never had. There's no injury. They've got a swelling. There are dark patches of bleeding under the skin, nausea, vomiting, which the child, you can't find any real reason why they are vomiting. Unannounced fever. We don't know why the child is feverish. Anything that is different needs attention, and we really owe it to our children that we do not neglect, but that we, as soon as possible, get them to see a healthcare provider so that a diagnosis can be made, because we know that an early diagnosis leads to early treatment, and that leads to them possibly and most probably going into remission and that they
Yeah.
can eventually be totally cured of their cancer.
All right, Professor, thank you so much for your time and for that insight for our viewers. That is Professor Michael Herbst. He is a health specialist consultant for the Cancer Association of South Africa Health, and talking to us there about issues around cancer, particularly cancer facing children and teenagers in the country.